Despite best efforts, falls in aged care environments do occur and unfortunately are often difficult to prevent. When a resident has a fall, it can be stressful not only for them, but for you, the caregiver. By taking the correct steps, you can ensure safety for everyone involved. In this video, we will particularly focus on injury assessment, resident reassurance, and lifter breaks. First of all, do not rush. Before any transfer takes place, you should always make sure that the resident is safe to lift. Somebody medically and appropriately trained should carry out an assessment. It is important that you do not attempt to transfer if injury prevents it. If the resident is assessed as being safe to lift, continue to offer them lots of reassurance and make them as comfortable as possible. Remember, they have just had a fall. They will be extremely anxious. Before the lift, make sure that the equipment is in good working order and the environment is safe and clear of obstructions. This is all part of your dynamic, day-to-day risk assessment. Also, as part of this risk assessment, ensure that you and other caregivers assisting you are safe and prepared to carry out the transfer. When the risk assessment is complete, you can lift your resident. Before applying, check that straps and labelling are visible on the outside of the sling. Then, assist the resident to roll onto their side. Do not lean or bend when doing this. Think about your positioning and your safety. Then, feed the sling under the resident. Help them to roll to the opposite side and unfold the sling so that it is central and in place. Ensure that the sling's material is not bunched up or gathered. The resident can then be assisted to roll onto their back. Ask them to slightly bend their leg or assist them to do so. Then, one at a time, bring each leg strap so that it is smooth under their thigh. Notice how Aspire slings have a yellow central loop. This can be used for additional dignity and comfort during the lift. When carrying out the transfer, one carer should stay with the resident and the other should operate the lifter. Remember, they need lots of communication and reassurance, especially because they've just had a fall and will be particularly distressed and nervous. In this situation, we are bringing the lifter in, approaching at the feet. However, depending on the location of the fall and the space available, you may need to bring the lifter in from a different angle. Carefully guide their legs over the lifter's base. Because this is a floor lift, brakes should always be put on for safety. This prevents the resident from accidental contact with the lifter while they are on the floor. Then lower the lifter so that the spreader bar is at chest level. Extra care should be taken to ensure that it doesn't come into contact with the resident, causing harm. Next, attach the sling to the lifter, ensuring the loop sits securely on the spreader bar. Begin the lift, ensuring their arms are inside the sling. When the sling becomes taut and just before the resident's body leaves the ground, check that all sling straps are still securely sitting in the spreader bar. And when moving the lifter, don't forget your safe manual handling practices. This is an example of an unsafe way of moving the lifter. The shoulder joint is one of the most commonly injured body parts when moving and handling residents. Protect yours by keeping your elbows by your side and below shoulder height. While one caregiver is controlling the lifter, the other should be protecting the resident and ensuring they do not come into contact with the lifter, causing accidental harm. Lower the resident to the bed. When they are safely lying, ensure that there is enough slack in the sling straps and carefully detach the sling from the lifter, again ensuring that you control the spreader bar to avoid injury. Take the lifter out of the way and remove the sling. Do this gently so it doesn't drag on the resident's skin, causing skin tears. Now, look after yourself. You have been working at a low level, so stand up, gently arch backwards and reduce pressure on your spine. Do this within the limits of your comfort. Remember these steps and our 3 focus points: injury assessment, resident reassurance and lifter breaks for safe resident handling in floor lifts.